Welcome to The Standard. From Vancouver, I'm Peter Klein. Tonight, a doctor who claims to perform bloodless brain surgery, treating everything from autism to attention deficit disorder. Neurotherapy is a holistic technique that uses visual depictions of a person's brainwave activity to try to solve psychological and neurological disorders. My guest, Dr. Paul Swingle, has been practicing the technique for more than 30 years. He's written a book about his work entitled Biofeedback for the Brain: How Neurotherapy Effectively Treats Depression, ADHD, Autism, and More. Dr. Swingle joins me in studio. Welcome.
Thank you.
So the brain emits different types of brain waves depending on whether you're asleep or you're daydreaming or you're awake or concentrating. Explain what you do with those waves. First of all, you map those, right?
Yes.
In your patients.
That's correct.
So how do you do that?
Well, it's really very straightforward. What we do is we measure the electrical activity coming from the brain. We use a standard EEG, an electroencephalogram, a standard device that's used in hospitals for people with head injuries and so forth. And what we're looking for are irregularities in how the brain is functioning, and that's measured by changes in brainwave activity. And as you alluded to, the brain has different configurations depending upon what's going on. So, for example, if you're asleep, we would expect to see strong sleep waves in very specific areas of the brain. Individuals who have a sleep problem, for example, have difficulty with those particular brain waves. Now, we do a brain map in which we look at the brain activity in the brain. We know what the brain should look like in terms of normal functioning, and the departures from that tell us what's wrong with the client. So, for example, I don't ask a client why they've come to see me. I tell them why they're sitting there because the brain tells me everything.
That must impress some clients if they've come to you. And
Well, it's not business as usual. I mean,
you don't sit down and start going through a history of your psychological, how your mother treated you, and when your first girlfriend dumped you and all of that, right?
Yeah. Well, that may be unfortunate, but it has nothing at all to do with what we're going to do.
Right.
No, we don't go through those intake assessments in which the person tries to describe what's going on. They find it enormously promising because they don't have to tell me what the problem is. They don't have to persuade me of anything. Very often people have to spend 2 and 3 sessions trying to explain what's happening to them. And we can tell them after 6.5 minutes of recording time.
Okay, so let's take someone with ADHD, attention deficit hyperactivity disorder, which is something that this technique seems to show a lot of promise for. Explain what's going on in the brain of someone with this, and then how do you help that person?
Sure. ADD and ADHD are not single disorders. They are an array of disorders. So the first thing we have to do is determine what type of ADD or ADHD we're dealing with, or in fact, if it is ADD and ADHD. One of the common problems we run into is children are being diagnosed with these problems when it's normal child behavior. We have a habit of medicating normal children's behavior because it's hard to deal with young kids. Often we'll get a child come in who has been exposed to a severe emotional trauma, and the trauma marker is apparent on the brainwave. And of course the child can't pay attention in school. They're frightened, among other things. So, for example, once we do the brain map and we determine that this is bona fide ADD of a particular type, I go over that with the parent and child in terms of what the symptoms are associated with this particular type of attention problem. And then I point out how we're going to correct it.
And so walk me through how you correct that.
Okay. There are three general classes of treatment in neurotherapy. The first is the one that most people are familiar with, and that's brainwave biofeedback, the actual title of my book. We set it up so that when the brain is doing what we want it to do, now what I mean by set it up is we put an electrode on the head and we actually measure the brain activity. So when the brain is doing what we want it to do, meaning it's moving towards more normal, efficient functioning, you'll hear a tone or see something move on the screen. Now we can set that up so the child's playing a video game with their brain. When the brain's doing what we want it to do, dolphins jump out of the water, you know, racing cars move around tracks.
And the child can actually control those brain waves.
And, you know,
I mean, how does a 5-year-old know how to control their brain waves?
Much better than you do. They take to it like ducks to water. It's unbelievable. An adult will very often say to me, well, how do I do this? How do I control it? A child has never asked me that question. They simply, you know. So
basically you're essentially lining up, I mean, some people have called it exercise of the brain. You're sort of exercising your control of that, lining up these brain waves. But then what happens when they leave, when they take the probes off?
The nice thing is, as you move the brain towards more normative functioning, it starts to normalize. So that's why we say once it's fixed, because the brain normalizes, the child does better in school. You have the developmental process kick in to do our work for us, and the child is receiving praise and reinforcement. Very straightforward.
Well, but like with ADHD, I mean, my understanding is that most of the research shows that whatever treatments you're using, whether it's behavior therapy or drugs or whatever, has to essentially continue to keep that child, and that's not the case with yours.
No, that's a very good example of the difference between fixing the source of the problem and trying to cope with the problem or sedate the problem. If you're using medication, for example, a brainwave stimulant, and when you remove the stimulant, the brain returns to the state that was causing the difficulty. If you change the brainwave associated with the hypoactivity in the brain, then the brain retains that, and the brain retains its more balanced normative functioning.
And some people have certainly criticized this, saying essentially it's the placebo effect. It's, you're telling a kid this is going to help you. He sees all sorts of electronic gadgets, and he figures, okay, now I'm cured. I mean, is there a placebo effect at all in your mind?
Oh, absolutely. And placebo is not a bad, it's not a I was going to say four-letter word, but it's nothing wrong with the placebo effect. I mean, what we're talking about is optimism.
But it's not only a placebo effect.
No, of course not. Optimism and enthusiasm about a change, that's going to take place. You can isolate the placebo effect. The placebo effect accounts for about 33% of progress in any treatment. Doesn't matter what you're doing, provided you set it up properly.
Well, in addition to patients benefiting from this, supposedly the Italian soccer team even used this technique in the World Cup a few years ago. We'll talk about that and a few other things in a moment when the Standard returns with Dr. Paul Swingle. Welcome back. I'm joined once again by Dr. Paul Swingle, a registered psychologist and author of Biofeedback for the Brain, How Neurotherapy Effectively Treats Depression, ADHD, Autism, and More. Now, in addition to those problems that I just listed from your book title, and in addition to children, you also see adults, you see athletes, for instance. You didn't see the Italian soccer team, but I understand the Italian soccer team in 1996 used this technique to sort of optimize their performance, and they credit it as one of the reasons that they did so well in the World Cup.
If you saw the foul shots, that was neurotherapy.
So what does an athlete want from you, and what do you offer them?
What they're looking for is optimal performance. The first thing that you do when you're doing optimal or peak performance for athletes, CEOs, and so forth, is the first thing is you normalize any condition that may be problematic, any imbalances that might be predisposition to depression or whatever. Once you get the brain balanced, then you optimize, and that is you increase the efficiency of the brain. We can be very precise in terms of what we do for CEOs, for example, in terms of how much the activity is going on in the brain, at rest and so forth. That's the one exception to the notion that once it's fixed, it's fixed. Because optimal performance is rather like, the best metaphor is going to a gym. If you want to be, in reasonable shape, you go twice a week for an hour or so. If you want to look like a bodybuilder, you go 8 hours a day, 7 days a week. And somewhere in between there is the optimal efficiency.
Mm-hmm. So, just hearing your description of all of this, it really does sound like this miracle cure. Even just on a sort of a cost level for Canadian healthcare or private insurances in the United States, I would think they would look at this and say, well, look, psychotherapy can go on for months or years. People with all these different problems can be on expensive pharmaceuticals for their entire life, and yet you are about $100 a session. You claim you can do it in a few sessions. Why isn't there more of a push for this? I mean, is there peer-reviewed literature out there that essentially proves this is effective?
Oh, yes. It's a huge amount. And if you go to isnr.org and click on their bibliography, you can research any kind of problem you want in terms of the peer-reviewed.
And the Journal of Neurotherapy is peer-reviewed?
Oh, yes, absolutely. A professor of mine who had a major influence on me told me when I was a wee one, he said, Paul, it's not science, it's politics. Okay? And a lot of this has to do with who's making money, what the political scene is, and so forth. All the all of the equipment we use is FDA registered and compliant. Even our databases are FDA compliant.
But it's FDA. The FDA only allows it for relaxation, not for treatment of
No, it's
for
disorders,
right?
ADD, and there are a couple of things that it. Now, relaxation, the way this. A lot of people think relaxation, well, I'll feel good, okay? Relaxation means quieting the brain.
Mm-hmm.
The concept there is a little different than our notion of what relaxation means.
Well, for instance, the Mayo Clinic has sort of half-heartedly endorsed this. They've said this is, potentially effective treatment, but not for depression and, other serious psychiatric disorders. And yet you do treat people with depression. You treat seizure disorders. Even, one of the cases I read was a complex seizure disorder with, grand mal and absence seizures and clonic seizure. This patient had a whole range of them, and you were supposedly able to help them, right? Mm-hmm. How is that possible? Neurologists all over the world are trying to help people with these complex seizures, and yet you with an EEG and a video screen can do this. It seems like, as you alluded to earlier, people who are desperate at the end of the road will turn to anything, and if it works, why is this not spreading all over the world?
Well, politics and money for openers. There are neurologists practicing this. There's a fellow, Dr. Jonathan Walker, in Dallas, Texas, a board-certified neurologist, and he has a major clinic in which he uses neurotherapy to correct a lot of these problems. So the data are out there. And a lot of this came from the work in the Menninger Foundation in Kansas in the United States, in which they looked at what Eastern treatment, mind control treatments, was actually accomplishing. And could this be simulated with EEG feedback? And the answer is yes. So a lot of what people have been doing for millennia, we're able to do technologically. Instead of it taking 20 years sitting under a tree, we can do in 10 weeks.
Right. Well, I think it's the National Institutes of Health in the States are sort of in the process of going through scrutinizing a number of these alternative. I think recently ginkgo biloba, for instance, sort of it's been supposedly proven not to be effective.
Right, yes.
And they're taking on this treatment soon, or maybe even currently. Do you think if that shows that proves that it's effective, that will have a real widespread effect on the use of this?
I think what you're going to find is that people are arriving at a point of real concern about their health care, about the methods that are used and the metaphors that are used in terms of how you treat these things. And once we reach that point, I think you're going to see things change markedly. And issues like self-regulation, which is what neurotherapy is all about, it's a self-regulation procedure. People are going to embrace that as a method for treating the cause of a problem rather than sedating it.
Mm-hmm. Now, right now, my understanding is, really, I could, with no medical background at all, could hang up a shingle and say, I'm going to be doing biofeedback. Because, I mean, there is a certification program that one can go through, but one doesn't have to go through that. The Canadian and the US governments don't necessarily require you to do that, right?
It is not a protected title.
Right. Like, I couldn't put up a sign and say I'm a dentist and start pulling teeth. I'd get arrested. But I could do this. I mean, that seems like that would be pretty harmful to the credibility of this, regardless of the success or the peer-reviewed literature, right?
Well, you can do it provided you don't use registered and certified equipment. Now, there are a lot of companies where you can buy EEG equipment, excuse me, that's not FDA registered and compliant. And anybody, as you say, anybody can hang on a shingle. The other thing that's a real problem is we have a lot of franchises popping up in which, we make this look simple, so they franchise it, and, bored perfume salesmen decide they're going to be neurotherapists.
Right. And there is potential harm. I mean, even
huge.
There are cases. There's a paper came out in 2008 that showed people with, children with, sort of bedwetting after this if it wasn't done right, and people driven into trees or.
Well, as I say to my clients, if somebody's messing with your brain, it would be nice if they had something to lose, like a license to practice medicine,
right,
or psychology.
One of the things that critics of this have pointed out is that it sort of sounds a lot like Scientology, that there is this sort of connection to this idea of this mind over matter and kind of morphing the brain. Have you heard that? What do you say to people who make that link?
Fully. They don't understand Scientology and they don't understand neurotherapy.
What's your opinion of Scientology?
No, I'm not going to go there.
I know it's dangerous, right? But I mean, that's not a, would you agree that that's not a sort of a, I mean, you don't subscribe to Scientology at all. But you don't see any link between that kind of work, the work that they're doing?
Zero. Absolutely unrelated.
What about the sort of popularity of these kind of biofeedback machines you could buy? I mean, you say that there are clinics, but you can even buy it for yourself, right? And just order it and do it at home. Is there a potential harm to doing that?
Huge.
Like what the machines that you could buy at home, are those similar to what you have in your clinic? Like, they're not EEG machines, right?
Well, it depends on what it is you're buying. There are devices that you can buy that in the United States you require a prescription to buy, but you can buy them over the counter here. Cranial stimulators, for example. EEGs to do neurotherapy. If you are buying an FDA registered and compliant, Joe Blow is not going to be able to buy one, to practice. But in terms of the ones that are not registered, and in Canada, it doesn't have an FDA, compliance structure, so they're readily available, or at least they can be. The potential danger, let's just take something like depression. Depression is an imbalance in the front part of the brain. Now, if the person puts the electrode in the wrong place and creates that imbalance, obviously you're going to have a problem associated with predisposition to depressed mood states. So, are there risks? Of course.
What about in terms of standard, kind of clinical treatment, the way you do? If you take someone I mean, a lot of people who come to you with depression or ADHD or seizure disorder certainly are on medication to regulate, as you say, regulate the symptoms rather than the root cause of it. And you've, in your opinion or in their opinion, solved the root cause. Do they get taken off the drugs? Is that safe to do?
We work very closely with the individual who's running the medications. We have a lot of physicians and psychiatrists who refer to us. The bottom line is don't be in a hurry. You know, you're being maintained on the medication. You've come to me because there's some issue associated with that. If you were as happy as a clam, you wouldn't be sitting in front of me. Okay? And very often it's the physician who refers the person to us. And what they want to do is they want to titrate that person down off the medication for whatever reason. So typically we'll start treatment, you know, we do the assessment, start treatment, and then work with the primary care physician to start the titration process, titrate down off the medication.
Well, it sounds like a fascinating technique. I mean, it's quite amazing that a lot of people, both in the public and even in the medical community, are unaware of this. Hopefully your book will, you know, help spread the word and,
Let's hope so.
And get some more research out there. Thanks for joining us.
Thank you.